Hey guys, another video on what sort of vitamin affects the thyroid. So let me just share. It's probably one well known that I've talked about in the past in my live streams. Anyway, this is an Indian study. Vitamin D supplementation reduces thyroid peroxidase antibody levels in patients with autoimmune thyroid disease, an open labeled randomized control trial. So that's all the information there about the medical institutions that were involved in India. Okay, the general abstract, background of aim, all through vitamin D deficiency has been linked to autoimmune thyroid disorders and a number of others, let's not forget. The impact of vitamin D supplementation on thyroid autoimmunity is not known. This study aims to evaluate the impact of vitamin D supplementation on thyroid autoimmunity, thyroid peroxidase antibodies, TPO, which is what I showed in the previous study. So that's a well-known marker in patients with newly diagnosed. When there's the thing there, AITD, I'm just going to be saying thyroid disorders. So just so people know what I'm talking about. In a randomized controlled trial. So material and methods, 102 patients with newly diagnosed thyroid disorders. And those are their TPO levels. And then they had basically analysed these people with sonographic evidence of thyroiditis, which is a method of scanning. Patients with were randomised in group 1, the intervention group, and group 2, the control group. Okay. So what do they do with the intervention group? So this is the vitamin D group. So group 1 received cholecalciferol 60,000 IUs weekly. That's one thing. I think that dose is too low, in my personal opinion. And that's 60,000 divided by 7. It's about 8,571 international units. So it's not too bad, but if you're dealing with autoimmunity, you'd really like to bump it up a bit. It's a bit like with Luke Gear and sort of his autoimmune issues. We really we bumped it up to the therapeutic levels. And you've got to basically get your vitamin D levels very high. Obviously, these are basically at what I call anywhere between 10,000, 5,000 and 10,000 is sort of like, I would consider sort of a general for healthy people, depending which part of the year, whether it's summer or winter, and the type of jobs they do and stuff like that. I don't consider this a therapeutic level, basically. I think it's too low. But anyway, they still got results, positive results, but I still believe that they would have got far better results with much higher levels. So I'll make that quite clear. I have never recommended this low. I do recommend much higher levels when it comes to people with autoimmune diseases, as you guys know. I try to get people's levels to very high levels of eventually, pushing up, depending, because there will be variations. So people usually, when they do approach me via email, I usually ask them, what is their adiposity? So what is their state of affairs, their nutrients, a lot of different things, because it does play a role. I mean, your poor nutrition can have an effect on the conversion rate So there's a lot of things here that could be confounding variables in the control group as well. So keep all that in mind. You know, these are not people on an ancestral diet, and they're not basically taking, you know, much higher levels for therapeutic reasons. So there's a lot of confounding variables that do have an effect on outcomes. So keep that in mind. Then they also gave them calcium. It's a sort of a standard thing that they do. I consider it not that important. If you're getting it in your food, but these people are probably not. They are from the south, the southern parts of India, you know, what we call the vegetarian belt of India. So let's put it, say no more. Group 2 received just the calcium for the 8 weeks. So obviously, one received calcium and vitamin D. The other one only could receive calcium, the control group. Personally, I would have liked a third group. I would have liked basically a control with no calcium, no supplementation whatsoever. But, you know, they'll probably trying to basically remove the possibility where people could say, well, you know, the calcium didn't have any effect. Well, if you had another control group there that didn't take any, then you'd be able to say that with certainty. Anyway, that's just a design flaw that I think that exists in here, but it doesn't detract from the results between the two groups, at least that. Group 1 received, and responders were defined as equal or less than 25% fall in TPO, sorry. Individuals at least 3 months follow-up were analysed. They did do a follow-up. Trial is registered with, this must be a certain registration body in India. Anyway, results from 100 thyroid disorder patients, 68 with thyroid stimulating hormones of less than the 10 milliliters unit liters, 32 with TSH greater than the 10, 93% having vitamin D deficiency. That's very high. But then again, it doesn't surprise me in India. It does not surprise me, even though it's in a tropical environment. You've got basically amongst these people were analysed. TPO-AB titers were higher amongst patients in the lower 25 hydroxyl vitamin D quintile. At 3 months follow-up, there was a significant fall in TPO-AB group 1, which is the intervention group, a reduction of 46.73% as compared to the control group, group 2, with minus 16.6. So is that being affected by the calcium? You know what I mean? That's another reason why I consider this a bad design. They should have had a third group with nothing. So they could say, well, it seems calcium has also some effect. Not massive, but some effect. So yeah, I do have a problem with that design. A bit of a, yes, I think anybody that looked at it would basically be a bit, you know, 68% patients in group 1 were responded compared to 44% of the other group. So that's, yeah. And you had a higher response rate in the group one, significantly greater reduction in the TPO levels were observed in those with thyroid disorders. So regression reveals group 1 followed by TPO and free tetrodoyathiroxine levels to be a good predictor in response to the therapy. Conclusions: vitamin D supplementation in those with thyroid disorders may have a beneficial effect on autoimmunity, as evidenced by significant reductions in TPO in this human trial. I still think that these levels of vitamin D intake, I don't like weekly. We've seen in other studies as well, both in animal trials and in human trials, weekly do not work as well. Daily is much better. You actually get much better results with daily supplementations than weekly supplementations. We've seen this over and over again. I do not understand when there's been a lot of criticism out in the literature in regards to weekly supplementation. But this is the problem with the standard of care in the medical field. Drives me up the wall. If you go to a doctor, they will not encourage you. They will give you basically weekly doses, big doses weekly. They're still following the same bullshit standards that have been done for a number of decades now, that have been basically haven't had the good results. And the doctors that have switched and said, no, I want you to supplement daily, are getting much better results because there are rate limiting effects. There are enzymatic rate limiting effects, how much you convert per day. And when you get these mega doses, you have a drop off in conversion through the week. So you don't actually even get that full, 8,500 or whatever levels. You'll get far less as you go through the week. And that's the reason why I vehemently dislike this method of intervention. But anyway, I've vented my spleen so you guys know. And there's a lot of criticism. There's a lot of people out there criticizing these. And they're not me. There are many other academics, other nutritionists, doctors in the field that have done research that have seen way better results in populations, where they're basically having better intervention approaches. The reason why am I using this study then? You're going to say, well, it's done in India, which typically is a place where you're in the tropics. And there, where you do see vitamin D deficiency, that's where you see autoimmunity in way bigger numbers, less confounded compared to other countries where you've got everybody in this sort of some people taking 1,000 IUs or 2,000 IUs, this sort of stuff. And what happens, it creates all these confounding. You don't get as severe, you're a bit more severe. And it's like, what's actually affecting it is really hard to weed out because it's so confounded. With low doses of vitamin D supplementation in Western countries and a number of other factors and all that, it really distorts a lot of these factors. Where in India, you've got people that are working outdoors and working indoors. And those who are getting less vitamin D from not working outdoors, tend to be office workers and tend to be the ones with also that can afford it, but also have these higher autoimmune disorders. And that's why you see even, amongst this study group, 93% having, being deficient, and probably others. And this sort of bullshit about insufficiency and stuff like that is, again, because they're going on the RDIs, if you know what I mean, in terms of the way we understand it. These people would be all deficient. I'd say 100%, in that regard. So in where it's quite clear cut, the vitamin D aspect in terms of the deficiency. That's why I've used this study, even though I'm critical about some aspects of it. Anyway, let's move on. Yeah, so they give us their motherhood statements. Vitamin D insufficiency has been linked to cardiovascular disease, insulin resistance, fatty liver disease, type 2 diabetes, and in complications, infections, and cancer. Yep, that's again T lymphocytes. I've talked about it. I've shown you the BMJ studies, which quite clearly shows that T lymphocyte go through the roof in terms of with good vitamin D levels. And T lymphocytes, most people that have got cancer have got very low T lymphocytes. Most people that have got very severe infections have poor T lymphocyte levels. Vitamin D improves that. That's why it's associated, obviously. It has also been linked to several autoimmune disorders, including autoimmune thyroid disorders. Observational studies have documented an inverse relation between those serum levels of 25-OHD and thyroid antibodies, TPO. Cross-sectional nature and small sample size are major limitations of these reports. Yep, that's true. Data on the impact of vitamin D supplementation on TPO in patients with thyroid disorders is not available. Hence, the aim of this present study was to evaluate the impact of vitamin D supplementation on thyroid autoimmunity in patients with newly diagnosed in a randomized controlled trial, which you should have had an additional group that didn't take anything, including calcium. So could have been done better, guys, in that regard. Now, I'm not going to go through the entire thing. People can read it at their own leisure. 981 consecutive patients on hypothyroidism were evaluated from the 102 with that disorder were fulfilled in inclusion and exclusion criteria, gave information, written consent, blah, 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 the sort of stuff they go through. Study protocol flow, patients were elaborated in one at least 3 months. So, oops. Yep, and that's the table 1, all the methods that they used, basically. Ultrasonography to make these determinations. Oops, go away. So, and these are their general tables of the measurements that they made. And here are actually the images as well. So they've provided all the images. People want to look at the images. Now, obviously, unless you're trained, you probably don't know what you're looking at precisely. But those who have any training in this area will probably be able to tell you exactly in that regard. And they do explain. They do put arrows here explaining what that sort of stuff. So people can look at that. I will attach this in that regard. Correlation between thyroid hormones, calcium metabolism parameters are adjusted for age. Another thing that I don't like when they do that, stick to the raw data. So, yeah. And you can see the difference between the intervention group and the treatment and the group 1 and 2. And again, not going to fit it in the whole thing, am I? Just fitting it. That's the intervention group, remember? Some of these others, you know, they've calculated smokers, non-smokers, blah, 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 a couple of things like that. Sort of the calcium phosphate levels. I mean, there's not massive differences. Obviously, you wouldn't, because they also supplemented those people and stuff like that. Sort of the levels that they initially found. And then they're looking at sort of the 3 monthly, sort of the differences, and then basically those reductions. As you can see, that was, remember, we'll talk about 16.6 after 3 months, and the other one was, yeah, well, there it is, the percentage drop. So those were the different levels. So obviously in the intervention group, you got more reduction, but there was some reduction as well. So calcium has been associated in other studies, but I would rather get it from food properly. So it's properly regulated. And also you're getting basically the taurine from animal foods, which will regulate calcium as well, which is important, menoquinone 4 and all the other sort of stuff. So these are things that, you know, because obviously 3 months isn't going to tell you, if you do this for a number of years, what are going to be the outcomes without those other important vitamins and stuff like that. Obviously, they're just looking at the TPO in this state, and obviously it has reduced in that regard, you know, and they're looking at the 3 monthly levels that are there. Okay. So that's in your millimoles. So for the others that are basically, so what have we got? Hold on, I'm a bit confused here. Not normally distributed. It's a medium range. Okay, so it is that 124 divided by 2.5. So 49.6 nanograms is what the intervention group 1, and the other group divided by 2.5. So they're about 40. So the difference there isn't massive, you know, in that regard. As you can see, it isn't massive, the vitamin D level difference between the two, but still, even with that small difference, and that's really something that actually I notice as well, and I'm going, and that is to look at the, you know, that the p-value is really high there. You know, the likelihood that that is just accident, you know, at those p-values, you know, where these ones are still good p-values, you know, where these other ones are very poor p-values, you know, I'll just ignore those, you know, when you get into these levels. But these variability could be up to all sorts of factors. That's why this is just very low p-values, very piss poor. These are better p-values compared to some of the others. But when it comes to the vitamin D levels, it's pretty good p-values. The likelihood that these values were just by accident, these are actually measured and averaged out between the groups very accurately. So when you look at that, maybe these people, because they knew they were on a trial of vitamin D, maybe they were exposing themselves a bit more. So even they noticed a bit of a reduction, because 40 isn't too bad, nanograms. It's sort of like that cutoff area, 100. Obviously, these are over the 100. I like people to be over 100, those 100 millimoles, and obviously the nanograms to be over 40 as well. So looking at that, I'm going, but you're still getting a result with a small difference in change, which is pretty good. I would say if you go to much higher therapeutic levels, you're going to get even a better result in that regard. And that's what I found with people that I've actually dealt with. My own subscribers, I've actually encouraged them to go much higher vitamin D levels, and they've actually seen their TPO come down quite markedly, back into the sort of normal range, really, really low levels, so, but that happens, can take a few months, that being exposed to the sun like Lukey did, or other people taking, because they may be in the Northern Hemisphere in a very cold environment like Canada and stuff like that. Obviously in those environments, you've got no option but to supplement to get those levels up. So it depends on that. But, still with even marginal levels, we can see changes in that regard. I would say higher vitamin D intake will even see more dramatic changes, in my personal opinion, in that regard. Unfortunately, we have not done those sort of studies, and that is what annoys me, that we're still doing the sort of what I call Mickey Mouse studies. That means studies where we're not doing sufficiently high levels of vitamin D in clinical studies where we've got, a couple of hundred people or more, or thousands of people, and doing really high doses of vitamin D to really basically tease out all confounders and everything. So I'm still, annoyed. That could have been done better. Actually, vitamin D insufficiency has been linked with several autoimmune disorders, including rheumatoid arthritis, lupus, type 1 diabetes, Crohn's, ulcerative colitis, multiple sclerosis, whereas previously a reported 75% prevalence of vitamin D insufficiency in normal individuals from Eastern India. The prevalence of vitamin D insufficiency amongst patients with autoimmune disorders in this study was 93%. And what they call insufficiency is what I call deficiency. And the other 7%, I suspect, are also marginally deficient. That was at the start of the study. And that's why I think, there wasn't, because this was done in people, remember what they said, free living. They were just told, you're taking the vitamin D, you're not, you're taking the other thing. And I think that is a problem, because other people may have cheated in the other group. And that's where that 16.6% came from. So there is a problem in the study. It is significantly higher than it is in accordance with the previous reports in patients with Hashimoto's thyroiditis, Graves' disease. Well, most of those other previous studies, the biggest problem was they were giving them very low doses. That's why. Based on the RDIs, like 1,000 IUs and stuff like that, which is ridiculously low. It just covers, bone disorders. It's a joke. I've seen plenty of studies on Hashimoto's and Graves' disease, on a number of autoimmune diseases where they're just giving the RDIs. A lot of them are in the US and Europe and all that. Some in the Europe are probably giving them 2,000 or 3,000 international units, but still a lot of them are just giving them very low dosages, or in this case, one-off dosages, but this was a much larger, because usually the ones that they do give them is 20,000 IUs or 10,000 IUs, one-off doses. So it's usually an injectable 10,000 IUs, one-off dose that is actually given in a lot of these sort of Western type studies. So at least they did ramp up the levels to 6 times what the Westerners gave. That's why they saw certain results. Can you imagine how higher, if you had pushed the levels even higher, the sort of results you would have got? Much higher in that regard. So I am disappointed that they didn't go much higher. Is significantly higher and is in accordance with previous reports. Yep. A recent cross-sectional study from Korea documented increased prevalence of TPO, possibly along with ultrasonography, featured in autoimmune disorders in menopausal women with vitamin D deficiency and insufficiency. That doesn't surprise me, as compared to vitamin D sufficient individuals. So that's just another observational study from Korea that they are referring to at 12. So that's that study there. There's plenty of research out there. And a Thai study observed increased prevalence of vitamin D deficiency, insufficiency with TPO antibodies. Again, a thyroglobulin antibody positive as well, TA. So individuals, when compared with those with negative antibody status. Again, if you're going to have very low or negative levels, you got to ramp up the vitamin D levels. There's no other way. I've been saying it, uffing and puffing like a mad dragon, like a carny mad dragon. But whenever I've seen people really, these are N of ones, obviously, a lot of my subscribers and other people out there that are doing very high doses and eliminating these problems. I always recommend balancing it with retinol and menaquinone 4, always. But I believe in higher doses if you're going to deal with autoimmunity. You need to get to those very high levels of 80 nanograms per liter and basically 200 millimoles per liter. That's where you need to get to those levels. Unless you get to those levels of the 80 nanograms or 200 millimoles, the conversion, 2.5 is the conversion. Unless you get to those levels, you're not going to basically affect the 1,200 genes that are related to vitamin D and start turning off autoimmunity. And you've got to do it, keep those levels up there for a couple of months to really reverse autoimmunity. These studies indicate and show that there is a relationship. Things go down by a certain percentage, but they're not going to fix the autoimmunity unless you turn off the damn genes. You can't turn off the genes if you can't access them at those higher levels. I will say that again. You've got to turn off the genes, guys, and get on a species-appropriate diet so you don't reactivate those genes with the species-inappropriate foods and lifestyles. Sun, salt, and meat should be your goal in life, your dietary goal. Anyway, in a contrast cross-sectional population-based China did not observe any relation with vitamin D status, TPO positive. However, in that study, an inverse relationship was observed between 25-OHD and TSH. Again, they were using very low levels again, and there were a number of other confounders. Early stages of thyroid autoimmunity, TPO positive, with normal serum TSH were not associated with vitamin D deficiency in a study in Holland, but they actually didn't really look at that in any detail, so it doesn't really count. A recent study reported inverse correlation in patients with Graves' disease, highlighting again links between vitamin D and thyroid autoimmunity. Different ethnic groups, disease heterogeneity of varying severity may explain the conflicting outcomes in it. There's another thing that you guys did mention, the low dosages. This is my pet annoyance with a lot of these studies. The dosages are too low. They're not getting up to the therapeutic levels, which I believe are 80 nanograms per milliliter, or basically 2,000 millimoles per liter. Unless you get into those levels, you're not going to basically turn autoimmunity off in a successful way, and obviously in a species appropriate diet. Only cross-sectional studies from India has observed a weak inverse relation between TPO and vitamin D. So in our study also, there was a weak inverse relationship with the TPO and 25-OHD, which approached statistical significance. This is the first study to demonstrate vitamin D supplementation in therapeutic doses. I do not consider that a therapeutic dose. You guys are just basically bullshitting. Is associated with significant reductions in TPO in patients with autoimmune disorder. Yes, you got a reduction. Whoopee. Yes, you reduced those levels from what they were by 40, what was it, 46, whatever percent. Yes, you nearly halved the levels. Wonderful. Pat yourselves on the back. But did you eliminate completely, go into negative territory? No, because you didn't go high on the vitamin D levels. It is associated with a significant reduction of TPO in patients with autoimmune disorder. So basically what these people are probably going to be recommending in the future is take your meds so we can keep Big Pharma happy, and take your vitamin D because it does help a bit. That's the sort of why they do these low vitamin D levels. It's endemic. Every single study that I see is all these low vitamin D levels. And I sort of sit there and go, you can go out in the sun for 15 minutes with light complexion and actually, get 10,000 IUs of vitamin D, or stay out for more hours and get up to 20 or higher levels of international units of vitamin D, which based on their levels, and this is for healthy people, 20,000, 8.5. Let's do it accurately. 7, even though it does drop off and I don't believe subscribe to that number. This is healthy people will get this sort of level, which is 2 1/3 times. And if you're out there and if you're lean and you're out there constantly getting these levels, you will build up to those higher levels. Or you can be out in the sun, like Luke. He basically was out in the sun continuously and he was just building up those levels and got eventually up to that glorified level of around 8, a bit, slightly over 80 nanograms, and felt great. Everything, he was even, and did more carnivore, obviously, because cholesterol does help with, you do need cholesterol to synthesize vitamin D in your skin. Another factor. A lot of these people are vegetarian and don't have enough cholesterol in their diet. All the steroid hormones are basically influenced, all your hormones, which have an interaction with your thyroid and everything else. So, a lot of these people from the southern parts of India, which we know are on vegetarian diets, which are poor in cholesterol as well. So that's another factor, a compounding factor. But even though here's people that don't get enough cholesterol in their diet and still are getting a 46, nearly half, reducing by half their antibody levels, TPO. Can you imagine on a species-appropriate diet and exposing yourself to much higher levels of vitamin D, the results? You wouldn't need Big Pharma, would you? Obviously. You wouldn't need the meds as well. Now, we can't do those sort of studies because otherwise we would show, obviously, on a species-appropriate diet like the Maasai eating meat, milk, and being out in the sun, you wouldn't need Big Pharma. If we did those sort of studies, that actually showed us quite clear those differences between a species-appropriate diet in the sun and a non-species appropriate diet and, your general sort of interventions and piss poor interventions and supplements of a low quality level with inappropriate cholesterol levels and everything else under the sun. Hope you like that. Subgroup analysis revealed that the quantum of reduction with regards to baseline in the treatment versus control was significantly only in patients with a baseline TSH of equal or less than 10. Obviously, but that doesn't explain all the other confounders. This may be explained by a more advanced disease state in patients with baselines greater than 10, potentially, but they didn't tease all that out and all that. Possibly, it is possibly if somebody has had disease for a longer period of time, but take Lukey, he had it for quite some time. He wasn't new to the disease, he had it quite some time, but he got up to those glorified levels of vitamin D, exposing himself out there to the senoritas in Brazil. So they must have enjoyed him sunbaking and basically, getting his levels right up there and sorting out putting this autoimmune disease into the toilet and getting rid of it. Hence, vitamin D supplementations in newly diagnosed autoimmune disease, thyroid disease. Patients may be the most beneficial in patients with early disease levels. At those levels, yes. At low levels of vitamin D supplementation, if you're early into the game and you haven't been as damaged, yes, that probably will work. That's why they were seeing those sort of effects when they looked through the data. I would have to agree with that. But if somebody's much more damaged, then obviously at those stages, you really need to go those very high and also get the species appropriate foods in to improve all the general health in that regard. But people that are just new to the disease, probably even those levels will have a significant effect on them, which is better than nothing, but still, it's not fixing the long-term problems for all of these people. It must be, however, we call that group B, but not a received the supplement, the levothyroxine supplementation. So they actually got them. So that group B actually got some of this. Okay. So obviously that 16% may be due to that. Well, that's a bit, which may have some impact on TPO. Well, because I'm just reading this through now, if you guys have just realized that. I hadn't read it already because I just downloaded it and I said, oh, I'll just do a quick video on it without, just reading right through it on the fly. How could they do that? So that's 16.6% here. Is probably due to the medication. What the effing? And they basically put it here. It must, however, be recalled that patients in group B that had higher levels. So that's the adjustment between the people that had, normal levels or lower levels of TSH that were early in the disease to normalize those two groups. Yeah, it's wrong. It's wrong what they did, that they basically gave the control group medication. That just really stuffs it up, as far as I'm concerned, because they've basically lowered through medication the TPO levels for the control group, and they've just invalidated the control group. They've given them an intervention. But even then, vitamin D still did better than the meds. You could say, but they don't have a control group now, because limitations of this study include an open label design of RCT, lack of use of placebo. Although they actually admitted it, that they don't have a third group, because they've actually caused an intervention here. So basically what we've got is a group A and group B with two types of interventions without a placebo control group that's not taking either the medication or the vitamin D. That is annoying. Anyway, at least we can say from this study that vitamin D, even in lower doses, works better than the medication. That's what we can say. So Big Pharma loses again. Vitamin D, the sun wins again. Yes. However, as of today's serum are perhaps the best measures of thyroid autoimmunity. And you stuffed the whole thing. Yep. Anyway, who did not? Reductions in children patients with those lower sort of TSH levels did not receive, thyroxine, underpin the role of vitamin D in bringing about this reduction. Yeah, but you could have basically created two different groups if you wanted to do that, people that were long-term or short-term, to show the difference in that sort of stuff. Yeah, but they have said one positive thing, that that they've actually, the vitamin D did much better, obviously, and it was even in lower doses as far as I consider therapeutic. I don't consider those therapeutic levels. This study highlights the need for further long-term interventions with vitamin D to evaluate if the reductions of TPO titulars translates into reduction progression of subclinical to overtly primary hypothyroidism, or is inducing remission of hypothyroidism, as evidenced by stoppages, reductions of the dose of levothyroxine, which would be a more clinically relevant outcome. Yes, it would, if you guys were basically affecting group 2 and had a placebo group, a complete placebo group, which what group B was supposed to be, not an intervention group, a secondary intervention group, which it ended up being. In conclusion, to conclude, vitamin D deficiency and insufficiency is significantly more common amongst those with thyroid disease patients in Eastern India. Yes, lovely, lovely place. Vegetarian nirvana. Vitamin D supplementation in these patients is associated with a beneficial effect on autoimmunity, as evident by significant reductions in circulating TPO. Yes, we did see that. And we did see the other one who was medicated as well, that had a reduction of 16.6%. So financial support and sponsors and nil, so no conflict of interest. So this was basically the authors, I think, for the Department of Endocrinology, Metabolism, and the participants for their important contributions. So it was basically a government funded with no external sources to affect, but without a true control group. So yes, a bit on the disappointing side. The study could have been done way better than it was done, but I thought it was important to look at a study from outside the North American or European environments where there's a lot of confounding due to the food supply as well. So people are eating a lot of processed stuff in the Western countries in comparison. So obviously these people are still, in Eastern India, it's still quite rural based. These sort of regions, yes, they're eating a vegetarian diet primarily, these sort of people. Yes, that's true. But so are the Westerners eating a processed kibble diet, 70% with 30% animal foods and very little of it. So these people are still getting some dairy and some eggs and stuff like that. So that's what a vegetarian diet is. So basically they're getting some animal nutrition, small amounts, like a lot of their Western counterparts, but a lot of their Western counterparts are also eating really what I don't classify as food in packaged boxes. These people are at least eating food that is actually coming from their own land or animals in terms of eggs and dairy products in that regard. Cows are sacred over there in India, so you can't knock them off for food. So yes, in that regard, it's insightful, but it actually just also shows you that add more cholesterol to the diet, which is important for the synthesis of vitamin D in the skin, and add more sun exposure or vitamin D supplementation, and things could even be way more dramatic. You'd get into the negative levels of these antibodies. So, as others have done when they've actually upped their vitamin D levels and gone to a more species-appropriate diet, they've seen those sort of results. So the take-home message is that you're going to get the best results in a species-appropriate diet in the sun. And, we can say that also vitamin D works much better than meds when it comes to bringing down TPO, these antibodies. So that's my take on this. You may have different opinions. I'll leave that to you. Some people may be very disgusted with not a placebo group in that at all. There were two intervention groups in a sense, or partially, the second one was partially interventional, so based on their TSH levels. So it is a bit annoying, but it is what it is. Anyway, hope you enjoyed that and got something out of it at least. Next time I'll read the whole study. See yous.